So now we're going to be talking about the misconceptions about suicide. So literally this means the myths and the facts about suicide. So you hear people talk about the fact that when you talk to somebody who is suicidal about his or her own thought, the person will actually have those ideas or will actually complete the suicide. No. Studies have actually shown that when you talk to somebody who has told you he's having those thoughts, it actually helps them to seek for help. They feel welcome, they feel safe in your hands. So it's good for you to ask somebody, are you having thoughts of killing yourself? How do you plan to kill yourself? Have you put down a plan? It should be straight and direct question. It doesn't give idea, rather it helps to keep them alive. Another second myth about the misconceptions about suicide is the fact that anybody who has tried to harm himself or herself is mentally ill. No, the fact that this has shown that people who are suicidal or who have tried to take their lives are not all mentally challenged or mentally unstable. We've had people, they may be in despair, they may be in chronic pain, it may even be a honor. We've known some countries where people die, and it's a honor for them. So please, not everybody who is suicidal, who has attempted to kill himself or kill herself, is mentally ill. Another misconception about suicide is the fact that people who are suicidal never seek for help. No. Studies have actually shown that people who have had thought of killing themselves or who have attempted to kill themselves, they have sought for medical care, medical advice 6 months prior to this. So we shouldn't see them like, oh, they never tried to look for help or they never sought for help. Studies have actually shown this. A fourth misconception about suicide is the fact that when somebody wants to kill herself or tries to kill herself, you shouldn't even talk to the person about it. They are going to kill themselves anyway. No. Suicide is preventable. And we should understand that in the prevention of suicide is multidisciplinary. It's not a one-size-fits-all. It involves a lot of departments: the health, the educational system, the legal system, the justice system, and of course the media too, because the way we project this in the media can even bring about copycat suicide. So yes, don't say the person wanted to kill himself anyway and then you should let the person die. The last but not the least about the misconceptions of suicide is that when people talk about suicide, they never really execute it. That is a big misconception. It's a myth. People show warning signs, and if you listen or watch the previous episode, we talked about the warning signs of suicide. These are the ways there are many ways rather people express themselves. Oh, for example, if I die, I know people don't miss me, or they start dashing out their properties even without you asking, or even if you ask, you know this person ordinarily wouldn't give out his or property or that item, but now he or she is dashing it out willingly. So please, these are red flags, these are warning signs. That person is seeking for help, that person is looking for how we can help him or her. Please reach out. As we round up, look around you. If you, a friend, a relative, anyone around you, you haven't heard from him or her, please, this is the time to reach out to that individual. Ask them, how are you? No, really, how are you? We need to reach out to people. We need to learn the culture of compassion. We need to show empathy to people. We need to understand where people are coming from. Most importantly, we need to listen to people, not judgmentally. We need to listen to them to understand them and meet them at the point of need. We shouldn't listen to respond to them. Because as you've all heard, suicide is preventable. We need all hands on deck to fight this societal menace, which is suicide.